Ontario residents will soon be able to go and see the dentist and the eye doctor again. The province has updated a directive allowing more than 24 healthcare services to gradually reopen. The lists include dentists, optometrists, psychologists, and massage therapists, to name a few. The services won't start again right away. Providers are only allowed to reopen when their respective regulatory colleges give the go-ahead. Dr. David Stevenson is past president of the Ontario Dental Association and a practicing dentist in Carleton Place, Ontario. He joins me now. Thank you so much, Doctor, for being with us. Tell us about some of the guidelines that you have to adhere to be able to reopen.
Well, we won't get the guidelines, the official guidelines. We're expecting them in the next day or so. But we are under current guidelines that allow us to treat emergencies and urgent care. But we are expecting the guidelines that came from the directive from the minister a couple of days ago to allow us to expand those services to things more like essential care and non-essential care. So, those people that have been waiting a long time to get that broken filling fixed, to get other treatment that they've needed, I think we're hoping that they'll be able to get access to it. But there will be challenges. There will be challenges.
So how are you going to do it? How can people go to the dentist, stay safe? How can the dentists and the hygienists stay safe?
Dental offices have always been safe, and that will continue. Things will look a little bit different at first. A lot of this will depend just on what the state of COVID-19 is in your community. Because it's true, we go into the grocery store, we go into other stores right now, and you can socially distance, and you can see some of the measures that have been taken in other industries. And those measures will have to be taken at the dental office as well. But you're right, when you get back, there comes a time when we have to treat a patient. We have to compromise those social distancing. And that's where we need other things that we can do, such as we need access to good quality personal protective equipment, otherwise known as PPE. But, Marcia, we've been down for 10, 11 weeks, and our patients need to get in to see us. And dentists realize that. And we will do absolutely everything we can to ensure it's safe for them.
So what about the timing then? I hear you that people need to get back to the dentist. I'm just wondering, and I know some other industries are going to say, hey, how come they get to open and it's impossible to maintain social distancing in that sort of environment? So do you think that the time is right now?
I think the time is right now. I think the time is needed now. Well, one of the difficulties with things being left this long, and we get it. We get it. This is something new to all of us. COVID-19 came at all of us very surprisingly. But there's a lot of dental treatment that we have been, I know in our office, we've been doing the best we can to manage it, to hold it off. But at some time, if we don't get back to treat our patients, these patients are going to end up in hospital emergency rooms, and that's not where they belong. To get the best treatment they can, to get the safest treatment they can, they need to get into the dental offices. And, dentists have been up for this challenge our entire careers, and we're up for this one. And we can get some help. Though one of the biggest challenges is going to be access to PPE, and that's going to place a bigger demand on those resources. So there will be limitations as to what we can do, but we will do it.
Okay, Dr. David Stevenson. He is the past president of the Ontario Dental Association, still a practicing dentist. Thank you so much for being with us today. We really appreciate your time.